Okay, so last video. So this is kind of where you're starting to progress. Your muscles are like waking up, firing, all that, and you're starting to do more functional things. So this is like my favorite part of therapy because I feel like this is really important. Because you could kick your leg out all day, but that's not really going to help you get up out of a chair, to be honest. It will help work on your muscle, but again, to be functional, to do things that you normally do, um, that's more important in my opinion, and I think in most PTs' opinions, um, and in your opinion probably too. You probably want to be able to get up out of a chair. Yeah, so I'll kind of do a couple. So these are mainly standing exercises, and there are ways to progress them, but again, it's really hard to individualize a program like on the internet kind of thing because I can't see you in person, and it is important for you to see someone to get a more individualized plan. Um, yeah, so this can kind of be like the general like getting started thing, but I would recommend seeing a PT near you just because that would be important. So I know it is difficult to get access sometimes, but definitely do your best. But here's something to start with. Okay, so we're getting back to the chair because you're really gonna see my legs. Here, actually, let's lower this a little bit. All right, so first thing that you can practice is literally simply getting up and down from the chair. So if you have armrests, awesome. And if this is hard for you normally, you can push up with that and come back down. So you can also really work on squeezing your butt on your way up. That way you're getting that extra kind of butt work there and the full leg work. So again, just kind of staying straight up and down. So simple, something you do anyways, but maybe do a couple extra reps to kind of build up the muscle strength. Going along those same lines, if you have, again, please have something nearby, you can work on mini squats. So just kind of coming down to like just a slight angle here, 45 degrees, just kind of work, again, squeezing your butt, short mini squats, okay? If those are getting too easy, my hips are very not flexible, so, but if they are getting too easy and you're able to squat deeper, widen your stance a little bit, maybe your toes are coming out a little bit, everybody's squat is different, but you can come down, and yeah, that's first squat of the day, so yeah, but you can start working on that. That's getting much more difficult, so please don't feel like you need to do that, but that is something you can progress to. Okay, something that I used to do in therapy when I had my knee surgery, I think it's really an awesome exercise, to be honest. They're called clocks, so we'll do this. I'll just balance on this leg first. So this really helps to strengthen, again, your entire leg. It's very functional, especially helps to control, that internal rotation, works on that hip strength. So what you're going to do, you see my heel here, hopefully. So you're going to just slightly bend so that I'll actually kind of hurt. I haven't done these in a while. So again, if it's hurting, please be careful. You don't need to do that much, even this little bit. If you can reach out further, so again, you can kind of see my knees actually kind of coming a little bit, but you want to just tap your foot. So you really want to control that leg, okay? So they're called clocks because you want to go around in a clock. So this is 12 o'clock and this is 1 o'clock, even though it's backwards, but yeah, so you go around until you reach 7 o'clock back here. So again, this is a lot of balance, control, overall leg stability, so it's a really great exercise. If you have a step available, which I do not because I live in an apartment, but you can stand on the side of the step and kind of do the same thing, and you'll kind of go down a little bit. Don't try this. Hopefully this doesn't end badly. But so don't stand on this chair like this. Just don't do that. But if you have like a block, a textbook, something like that, you can do, again, just kind of give you that little bit of area to kind of come off of there, okay? So again, please don't stand on a chair, but that's something. Another one you can do, have a chair nearby. We'll call it the three-way hip. So it's just working on, so you can see from the side here, straight out, okay? Working on your hip flexor a little bit, coming out to the side. So we'll see. So key thing with coming out to the side is don't do this, okay? So that's working your hip flexor again, and that's causing other issues up here. You want to come straight out. So keep that knee facing straight forward, okay? And your toes straight forward. Straight out to the side, okay? And then straight to the back, okay? So, I'm sorry, I keep saying okay. When you do this, you want to make sure you're focusing on squeezing your butt. Again, it's all about squeezing that butt, I'm telling you. So, squeeze the butt, don't like arch the back. So see, so this is me arching my back, and then this is me squeezing my butt. There's a huge range of motion difference. If you keep arching your back and doing all this crazy stuff with your back, you're going to have back pain. That's just the way it is. I mean, maybe you won't, but most likely you're going to end up overusing your back and compensating with that and having some sort of back pain. So just work on squeezing your butt. You do not need to kick your leg up really high. It's not important here. Yeah, so those are all kind of things that you can do. If you start getting better, you can start doing some of those exercises on a Bosu. So I've done squats on a Bosu ball. That's the ball that's like half flat and then half like an exercise ball. Again, have something nearby. Please be careful. You can start doing other like lunges and such. So I'll do some lunges here. I used to hate lunges personally, and squats after my knee surgeries especially. Like I said, it's taken me years to build up my muscle again, and I do still have some knee pain, so that's just, I do my own therapy all the time. Yeah, so, but I'm telling you, the more like strength I've gained, the stronger I've gotten over the years. Now I actually enjoy doing squats and lunges, and like, yes, it does hurt a little bit, but it's more of like a muscle soreness. It's not the knee pain itself. There is a difference, so just, again, listen to your body. Don't push it too much. Something else you can work on are single leg bridges. So those bridges that I was doing before with both legs, I'll show them here, the single leg. You can also put a Bosu underneath your foot there. You can, if you're at home and you don't have a Bosu ball or something to balance on, you can add like standing on a blanket as like an unstable surface that kind of makes your body work a little harder. Even a pillow or something like that to kind of give you an unstable surface. Sometimes even really fluffy carpet makes it more unstable, so that could work as well. But here, so single leg bridges. Tilt down a little bit more. Same thing as regular bridges, but this time just one leg. So you're going to put this leg out and focus on bringing that one up. Again, focus on squeezing that butt there, okay? So this is a little more difficult for sure. And try not to like do this weird rotating thing. Try to keep everything in line. All right, and I'll do a lunge or two. So when you're lunging, you know, you can do just walking lunges. If you're having a lot of knee pain, you probably want to try to keep, so it's not going like over your toe or anything like that. Try to keep more, just, if you want to do just little baby ones, that's fine too. If you want to go down a little lower, just be careful. Again, in the general population, just depends on who you're talking to, what PT and what they were taught and what they believe in. But a lot of times they'll say, like, don't put your knee over your toe, and that is definitely a good recommendation for people with knee pain. However, many people's jobs and roles in life require them to have their knee go over their toe, so you might need to train in that area. However, again, please see someone personally if you feel like that's you, and be careful. Yeah, so if you guys have any other questions, so all these exercises, again, the generic number is 30. It's really hard for me to individualize that, so if you feel like that's not really right for you, which it may not be, you know, just kind of listen to your body. Definitely, like I said before, if you can, try to seek out a physical therapist near you. You can show them this and kind of be like, hey, like, she has it, so yeah, so maybe if they're not really familiar with it, hopefully this will help them to understand it a little bit more, and just kind of see the differences between a normal person's anatomy and our anatomy. Not a huge difference in some people, you know, like myself included. I know I have kneecaps and they are small, but, you know, I'm still a very functioning person in life. But yeah, so anyways, so if you are able to see someone nearby, awesome. If not, definitely use this as a beginner thing. Like I said, maybe like 30 reps, either 3 sets of 10 or 2 sets of 15, depending on what kind of rest breaks you want. If you want to start off less than that, awesome, do it. But yeah, if you have any questions, just message me or send me an email, and I will do my best to get back to you as soon as possible. So thanks.